the platform, the foundation of Australia's performance during the course of the COVID-19 pandemic has been the strong health system that Australia has and that we have strengthened over the course of this COVID-19 pandemic. A strong health system federally, a strong health system at a state level. And I thank all of our state and territory jurisdictions. We'll be meeting with them later today as part of the National Cabinet for our last meeting this year. It has been a team effort as we've worked hard to provide that strong health platform upon which Australia's economic comeback has also been conditional upon. The key part of that process of ensuring that our health system has been strong is that we've had a clear plan, and that plan has been based on the best possible medical advice and scientific advice. And it's a plan that has enabled us to move swiftly and decisively in response to events as they have unfolded. The COVID-19 pandemic writes its own rules. We don't get to write those rules for it. We need to be able to adapt and respond consistent with the plan that we've developed in partnership with our medical and scientific experts. Our vaccine strategy and our vaccine policy had identified 4 vaccines that we believed, based on the scientific advice, had the potential to go through to the end of stage 3 trials and be available here in Australia. At no stage can I assure you that we believed that all 4 of those vaccines would likely get through that process. If that had occurred, that would have been truly extraordinary based on the process of vaccine development, not only in this country but anywhere else. So that's why we spread our risk. That's why we backed important projects. And that's why we pre-prepared to ensure that we could deal with any issues along the way. The advice that we have received, and the National Security Committee of Cabinet met this week and made the final decision yesterday, is that the University of Queensland vaccine will not be able to proceed based on the scientific advice, and that will no longer feature as part of Australia's vaccine plan. I do want to thank, though, Professor Paul Young and all the team up there at University of Queensland for the amazing work that they have done in getting the vaccine to that stage. And we will continue to support and fund the work that they're doing on molecular clamp research on vaccines, which has application in many other areas. They're doing great work. They are amazing. I'm incredibly proud of all of our scientists for the awesome work that they've been doing to support us this year. And so I congratulate them and thank them for all the hard work they've put in this year. But as part of our strategy, it means that we've been able to reposition and redeploy both our resources and our capability to deliver these vaccines. And so we are increasing our production and purchase of AstraZeneca vaccines from 33.8 million to 53.8 million, and we're increasing our access to the Nova vaccine from 40 million to 51 million. So that's an extra 20 million doses of AstraZeneca and an extra 11 million doses of Novavax. The AstraZeneca vaccines, of course, manufactured here in Melbourne by CSL. Safety and health. That has always been the starting point for all of our responses when it comes to the COVID-19 pandemic. Having a clear plan, getting clear advice, making decisive decisions to ensure that we can put the health interests of Australians first, that lays the platform for the economic recovery that is undertaking right now as we end this year and go into 2021. I particularly want to thank the Minister for Health, whose leadership in this area over the course of this year has been exemplary. He is one of the standout health ministers of the world in terms of how he has led our response and put Australia in such a strong position to be where we are as we go into this Christmas. He has obviously also been ably assisted by Professor Kelly as the Acting Chief Medical Officer and Professor Murphy as the Secretary of the Department of Health. They're a great team, and I thank them for their work, and I'll ask the Minister to speak and then Professor Murphy.